Hello everyone. Today is going to be an introduction to what the DSM is and what it is about, what it includes. So we'll be going through discussing of why the DSM came into being, why it is used. So basically the DSM is the Diagnostic Statistical Manual for Psychologists, where it is actually a manual for psychologists and psychiatrists to diagnose different disorders or different kind of mental illnesses or mental health issues that are present. They can include ADHD, or they can include depression, anxiety disorders, and other types of disorders that are present. So it is basically a manual that is used by psychologists to interpret and to make a treatment plan of what happens and how it goes. It is actually classification of mental disorders with a specific criteria. For example, some disorders need to have a criteria of some symptoms showing for at least 6 months, whereas some disorders need a criteria of at least 2 to 3 weeks. So this is actually used to facilitate diagnosis and more reliable results. It is the most reliable source that psychologists have, and it gives the best technique. It gives the direction towards psychologists and mental health practitioners on how to go about the treatment. Now, there are a couple of reasons why the DSM is used. Firstly, it is a representation of developmental issues related to the diagnosis. The change in chapter organization better reflects a lifespan approach, with disorders more frequently diagnosed in childhood, for example, neurodevelopmental disorders, which include ADHD and autistic disorder, at the beginning of the manual, and the disorders are more applicable to other adulthood, which are neurocognitive disorders, at the end of the manual. Also, within the text, subheadings on development and course provide descriptions of how order presentations may change across the lifespan. The second reason why it is used is that the integration of scientific findings from the latest research in genetics and neuroimaging gives us more of a chance to see what is happening and why it is happening. The revised edition, which is the fifth edition of the DSM, which is currently used now, was informed by research recently done in neuroscience and by emerging genetic linkages between diagnostic groups, genetic and physiological risk factors, prognostic indicators, and some putative diagnostic markers are highlighted in the text. This new structure helps improve the clinician's ability to identify diagnosis in a disorder spectrum based on environmental exposures, genetics, and vulnerability. Thirdly, consolidation of autistic disorder, Asperger's disorder, and pervasive developmental disorder into autistic spectrum disorder is highlighted here. Symptoms of these disorders represent a single continuum of mild to severe impairments in the two domains of social communication and restrictive repetitive behaviors or interests, rather than being distinct disorders. This change is designed to improve the sensitivity and the specificity of the criteria for the diagnosis of autism spectrum disorder, and to identify more focused treatment targets for the specific impairments identified. Furthermore, streamlined classification of bipolar and depressive disorders have been done. This is done because Bipolar and depressive disorders are the most commonly diagnosed conditions in psychiatry. Excuse me, please. It was therefore important to streamline the presentation of these disorders to enhance both clinical and educational use. Rather than separating the definition of manic, hypomanic, and major depressive episodes from the definition of bipolar 1 disorder, bipolar 2 disorder, and major depressive disorder as the previous edition, we included all of the component criteria within the respective criteria for each disorder. Restructuring Restructuring of substance use disorders for consistency and clarity has been added. The categories of substance abuse and substance dependencies has been eliminated and replaced with an overarching new category of substance use disorders with the specific substance use defining the specific disorders. There has been another part added which is enhanced specificity for major and mild neurocognitive disorders. Given the explosion in neuroscience, neuropsychology, and brain imaging over the past 20 years, it was critical to convey the current state of the art diagnosis of specific types of disorders that were previously referred to as the dementias or organic brain diseases. There has been a transition in conceptualizing personality disorders. Although the benefits of a more dimensional approach to personality disorders has been identified in previous editions, the transition from categorical diagnostic system of the individual disorders to one based on the relative distribution of personality traits has not been widely accepted. In Dsm V, the categorical personality disorders are virtually unchanged from the previous edition. However, an alternative hybrid model has been proposed to guide future research that separates interpersonal functioning assessments and the expression of pathological personality traits for six specific. Who is it used by? So it is used by therapists, psychologists, counselors, psychiatrists. And what is it used for? It is used to correct the diagnosis that is made and helps to come to a correct and accurate treatment plan. So who exactly are these people who use them? A psychiatrist is a medical doctor who specializes in mental health, including substance use disorders. Psychiatrists are qualified to assess both the mental and physical aspects of psychological patterns. Psychiatrists are also doctors who can prescribe medicines, and they can actually perform a full range of medical, laboratory, and psychological tests combined with discussions with the patients or with the clients. Um, a psychologist is someone who studies the mind and behavior. A psychologist actually encompasses a wide range of speciality, including such things as organizational behavior and treating mental illnesses. It comes with great detail where there are different types of psychologists, such as research psychologists, mental health psychologists, and they often work together. Now, a counselor is someone who usually gives counseling or talks about a specific issue for a limited amount of time, whereas a therapist helps you to understand yourself and your patterns of thought, feeling, and behavior. Counseling involves working with mental health counselor or clinical mental health counselor on a specific issue for a limited amount of time. Whereas therapy can be more long term and focused on you as an individual, how you see yourself, the world, your thoughts, and your behaviors, as well as the underlying patterns of why you do things. So these are the mental health practitioners that are present who, go about using the DSM and go about bringing help and making a difference in mental health.